We've got time for a couple of questions for the panel, if anybody has one. I don't hear it.
So the programs that we just heard about were really, I would say, ambitious and very well thought out. I didn't hear, however, a lot about the challenges related to education of the practitioners who get this information and the patients and their families who get this information. It's a huge challenge. In the U.S., of course, this is in the purview of the practicing physicians and genetic counselors. We don't have nearly enough genetic counselors to deal with this onslaught of information. So I'm wondering what folks in other places in the world have thought about in this regard.
Yeah, so that's one aspect I didn't go into, but I think there was something like 17 million put aside just for sort of training. So a large part of that is master's courses in genomic medicine, which is, I guess, sort of largely students, but there's kind of clinicians coming along to these master's courses as well and kind of getting more up to date in genomic medicine. In terms of the patient outreach, I think we're just sponsoring more sort of genetic counselor training. That's kind of the way we're tackling that.
I recently spoke with, on that issue, I recently spoke with Holmes Morton, who has been doing rare disease work for decades. And we were thinking about the possibility of creating online clinical cases exemplary of different classes of these things for clinicians to interact with, as well as perhaps some kind of web-based guidelines for the patients. It's going to be very hard to generalize, but that's one solution.
Yeah, so I think this is a huge, huge issue, as you've pointed out, and is an area that as we're scoping possible projects to work on, pilot projects, to work on within the forum, and that would engage and resonate with international partners. The challenges around workforce, the future of work is an area that the forum thinks about generally, and that's in all different types of industries. Healthcare is no exception. So part of the scoping that I've been doing is trying to get smarter about how physicians are required to keep current as they go through their profession, and what the incentive structures look like, what the accreditation process looks like, how medical school deans and organizations are thinking about advances in this space, and what are the mechanisms by which we may, perhaps with our convening ability, could look at having a conversation and figuring out places to test or standardize things that may already be happening or elevate things that may already be happening in the educational space. I won't pretend that this is easy at all. I wouldn't, wading into a thicket of accreditation around professional qualifications and who gets to grapple with that or set that up is really challenging. But again, I think also from the global perspective, I'll just go out there and say that I've started to talk to some of the institutions in China who are educating pharmacists and medical professionals. So I think in looking at all of our pilot projects, we will look for those places where they're ready to or might have the ability within their institutional structures to tackle any of those issues that I outlined. But the workforce one for me is like right up there at the top of something I think is just sort of ripe for being looked at and dealt with.
May I answer? Our program is divided into pediatric section and the adult section. And the pediatric section started initially. And we have probably visited most of the medical schools in our country to tell what our intent is. And by sending some patients from those medical schools, I think we are exchanging the thoughts and tips and pitfalls, like as an on-site job training, I think.
Concerning the French organization, I mean, it's linked to the university and hospital, and the teaching and the formation of the practitioner, of course, is planned in the project. And concerning, I mean, the family and the patient, I would say that the patients which have a very rare disease are really concerned about what they have, and they learn quite rapidly in contact with the physician and all the information that they can have around this plan, which is public.
Great. With that, I think we'll transition to our next session. Thank you all for your contributions.